Good afternoon, everyone, and welcome to today's National No Smoking Day webinar. This webinar is being brought to you by HSE Health and Wellbeing and the HSE Tobacco Free Ireland programme. My name is Ed Murphy. I'm a project manager with the HSE's Tobacco Free Ireland programme, and I'm going to be your host for the next hour or so. So, National No Smoking Day takes place every year on Ash Wednesday and is a health awareness day intended to help people who might want to quit smoking. So we'll talk about quitting today, but we also want to give you a broader sense of what tobacco control looks like in Ireland, and hopefully encourage some of you into action and getting involved with us on the Tobacco Free Ireland mission. We have a large audience this afternoon, and it's great to see lots of variety in terms of where people are coming from. So we have colleagues internally from the HSE who will be familiar with us on the team and the work that the programme does. But we have some colleagues on from the community and voluntary sector. We also have some local authorities. I can see that we have some third level education institutions on. We also have some international colleagues and representatives from the World Health Organization with us. And I get the feeling that lots of you are joining us in a personal capacity as well. So it's great to have everybody on, and you're all very, very welcome. So I just wanted to give you a quick sense of what you're going to hear and who you're going to hear from this afternoon. So Martina Blake is the national lead for the HSE Tobacco Free Ireland programme and is one of the strongest voices in the room when it comes to advocating for tobacco control in Ireland. Martina will give you a sense of how Ireland is doing in terms of our prevalence of tobacco use, how that impacts on our own personal health and the wider impacts on society and our health services. And Martina will give you a whistle-stop tour of the various pieces of work that the HSE does on tobacco. Dr. Paul Kavanagh is a consultant in public health medicine, and he's the clinical lead for tobacco in the HSE. Paul's going to speak a little bit about COVID-19 and tobacco. He'll tell us a bit about new national stop smoking clinical guidelines that we're getting ready to publish with the Department of Health this year. And he'll speak a little bit about e-cigarettes and our current thinking on those products. Darina Carr works with HSE Communications, and Darina is the campaign manager for the Quit campaign. Hopefully some of you will be familiar with Quit from the TV and radio ads. I think there's a poll about to launch now just to ascertain how many of you know about Quit. If you're not familiar, you certainly will be by 1 o'clock today. Darina is going to talk about the overall aims of the campaign, and she'll show you why it looks the way it does in its current form, and she'll show you the TV ad that's airing on television at the moment. So I'm then going to have a chat with David Phelan, who's a stop smoking advisor in the HSE, and you'll basically get it from the horse's mouth what it's like to come to a service and what you can expect as a member of the public who's coming to use the HSE stop smoking service. We'll then hear from Nicola Morley, who's a development officer with Mental Health Ireland. And Nicola's going to speak to us about smoking, mental health and recovery. And she's going to give us some information and some background about a national conversation cafe that Mental Health Ireland and the HSE teamed up to host recently. Interspersed throughout the presentations today, we'll be showing you a suite of videos of our Quit leaders from last year. These were members of the public who we followed through their Quit journeys. So you should get a sense of their story as we move through the webinar. And at the end of the session, we'll introduce you to our new Quit leaders who we're going to follow through 2021. So the webinar is being recorded today, and all of the presentations and links to the videos will be made available on the Tobacco Free Ireland pages of the HSE website later on today, and we'll send everybody the link to where these will be at the end of the webinar. The Q&A function is open, so guys, do please feel free to use the button to ask questions. We will endeavour to answer as many of these as we can live, but if there's anything very specific that might require some time or a more detailed answer, we'll be able to download a question and answer report after the webinar, and we can follow up with those of you that we might need to individually. So to open proceedings, we're going to hear from Minister Frank Feehan, who's the Minister of State with responsibility for public health, wellbeing and the National Drug Strategy. Minister Feehan has very kindly recorded a message for us this afternoon, which we're going to show you now, and immediately afterwards you'll hear from Martina. So from all of us here on the HSE Health and Wellbeing and Tobacco team, we really hope you enjoy the webinar today, and I'll speak to you again shortly.
Hello, I hope you're keeping well. I want to begin by saying thank you to the HSE for inviting me to address you all today on National No Smoking Day. In my role as Minister for Public Health, Wellbeing and the National Drug Strategy, I would like to welcome you all to this webinar. I would also like to thank all of you for your interest in and support for the Healthy Ireland Health and Wellbeing agenda and for supporting the HSE in helping people to quit smoking. I am proud of the fact that Ireland has been a world leader in the area of tobacco control policy over the past decade, and together we have achieved a reduction in tobacco use from 23% to 70% smoking over the last 5 years. Indeed, through the work of Healthy Ireland and the delivery of the HSE Tobacco Free Ireland programme, we already have a strong network of partnerships and key stakeholders who have helped bring about this reduction. However, reducing rates of smoking continues to be challenging, and we need a particular focus now in disadvantaged communities and specific groups of the population, such as, for example, those with mental health challenges, so that we can reduce health inequalities and improve the quality of life and life expectancy for everyone. We also need to protect the next generation of children in Ireland from being recruited by the tobacco industry, which is why one of the underlying principles of our national tobacco control policy, Tobacco Free Ireland, is the protection of children. And we know that we need support from every sector in society to achieve the target of a tobacco-free Ireland. The purpose of this webinar is to highlight some of the key learnings from our work to date and to build an alliance of those agencies and individuals who can support us to achieve our goals. We know that people who smoke are likely to get sicker if they get COVID-19. Their ability to fight the virus is compromised due to their smoking, so supporting people to quit is our priority. The HSE's Quit for 28 Days campaign provides support and guidance on how people can quit by signing up to Stay Quit for 28 days. You will hear more about this from the HSE today, as well as hearing from people who have been on the journey of quitting themselves. COVID-19 restrictions have posed immense challenges to our well-being, and taking a positive step in promoting your health is something I would encourage you all to do. I appreciate that this pandemic is challenging for many, but what better way to use this time wisely to invest in ourselves and our own health and well-being? If you smoke, quitting is the best thing you can do to improve your physical and mental health. I understand that many of you attending today already support people's health and well-being, either through your work, volunteering, or in your family. And I would like to take the opportunity to acknowledge your contribution and efforts. I hope you all get some useful learning today to bring back to those who need our support the most. Thanks again for taking the time out to support the National No Smoking Day, and I hope you enjoy the webinar. Thank you.
Hi there, Martina Blake here. I'm the National Lead for the Tobacco Free Ireland programme in the HSE. You're all very welcome and delighted to have so many people involved and listening in today. So I'm just going to take you through where we are in terms of tobacco prevalence. We're really lucky in this country to have robust, well-powered national surveys commissioned by the Department of Health every year, which give us a sense of where we are in terms of health behaviour change. So we can see from the Healthy Ireland survey over the last 5 years that we've certainly made a dint and an inroad in terms of reducing smoking prevalence. And we've reduced from 23% smoking down to 17% from the last survey that we have from 2019. We also can see, I suppose, that the smoking prevalence, the gender gap is still there. So we have more men smoking than women, 19% male smoking versus 16% women. But where we really need to focus our energy is around disadvantaged communities. So the reduction in smoking hasn't been seen across all of our populations. And in our deprived areas, daily smoking rate is still very, very high at 21%. And in the affluent areas, daily smoking rate is 9%. So there's a huge gap there. So we absolutely need to focus our energies there. In terms of e-cigarette use, we have a prevalence of 5% at the moment, reduced from 3% in 2015. But at any one time, 2/3 of all smokers are thinking about or planning to quit smoking. So that's really positive. And what we need to do, I suppose, is harness that energy and those smokers and get them to quit using our services and using medication, because we know that that's the most effective way of quitting. So why are we interested? What's the annual impact of tobacco use? Why are we so interested in reducing smoking prevalence? We know that smoking is the largest preventable cause of mortality and morbidity in Ireland, causing 100 deaths each and every week in this country, 6,000 deaths a year. That's a staggering figure, really. It's the equivalent of 2 large buses crashing, for want of, as an example, every single week. Absolutely, we're also trying to deal with COVID in the current situation. And COVID is tragic because it's not of our own doing, and there's a huge mobilization of the health service and of our external organizations in addressing that. And I often think to myself, if we had that mobilization of the health service and of our external organizations in addressing tobacco control, look what we could achieve. So the impact of tobacco use is absolutely staggering. We have over 21,000 day case admissions, over 33,000 inpatient hospital admissions, 309 bed days used annually. It costs the health service 460 million in health service costs alone. And that's not the only cost. I suppose we need to think about the personal cost, the cost of families, grandchildren growing up without their grandparents, people losing their own parents very early, the social welfare burden when the breadwinner is lost in a family, and the litter and the cleanup costs. 55% of all litter in Ireland is tobacco-related litter. And it is really, we have local authorities on the webinar this afternoon, and it's really tobacco control, I suppose, helps you to implement your sustainable development goals and to work on improving the environment and the local communities that you serve. So how do countries and what's the recommended policies and framework for how we address tobacco control? We're still working off the WHO Empower model, which was published in 2008 and is still as valid today as it was when it was first published. So they have recommended 5 steps for governments and countries to take action in terms of addressing tobacco control. The first step is to monitor tobacco use and our prevention policies. And we do that here in this country. The next step is to protect people from tobacco smoke and from secondhand smoke. And we're really lucky in Ireland to have strong legislation. We were the first country in the world to introduce the smoke-free workplace legislation. We also have legislation banning smoking in cars, carrying children. So those are some of the measures to protect people from the exposure. We know that secondhand smoke is a Class A carcinogen. Offering help to quit tobacco use and providing really comprehensive, well-funded stop smoking services is a really important part of trying to reduce smoking prevalence, obviously, and supporting people to quit. Warning about the dangers of tobacco use through well-funded and well-tested mass media campaigns, and we're very lucky in this country to have really well-functioning mass media campaigns for quit, and we'll be talking a little bit about that later on. You'll get to see our new ad. Enforcing bans on tobacco advertising, promotion and sponsorship. That is carried out by the Department of Health in terms of developing legislation, and by our colleagues in environmental health in terms of implementing strong tobacco control legislation. So that would be around the point of sale of advertising. We have a ban on that, a ban on sponsorship. We now have plain packaging, which takes away the last marketing tool that the industry had in order to attract children. We have new legislation coming on board in terms of banning the sale of e-cigarettes to minors, and that is really important that we bring that forward very quickly. So, and the final action is around raising tobacco taxes, and we know that that is the most effective method. And thankfully, in this country, we do have strong leadership from our government, and we do increase taxes year on year. So the policy and strategy and how we work in the HSE, I suppose, is governed and underpinned by government policy. So we have two strategies that underpin our work: the Healthy Ireland strategy and the Tobacco Free Ireland strategy, which was published in 2013 and has a lifespan to 2025. And within those strategies, the overall aim of those strategies is to reach a smoking prevalence of 5% by 2025. And there are four kind of key areas within the strategy in order to do so. And that's to denormalise smoking for the next generation. So we want to raise the next generation of children in a tobacco-free Ireland. We need to improve how we treat and support people who come into our services to quit and have a consistent approach across the country. We need to provide cessation support, invest in our cessation services, improve those, and provide access to people through lots of different methodologies. And we obviously need to promote tobacco-free environments. We're doing that internally within the HSE through our own policies, but we also need to promote those environments externally as well. And we'll give you some examples of how we've tried to support that in our various communities, local authorities, and in the Irish Prison Service. So within the Tobacco Free Ireland programme, there's a small team of 5 or 6 of us, and then a wider team of stop smoking advisors and health promotion officers across the country delivering services. So what we do, I suppose, is we're responsible for our mass media campaign, and we have developed 4 different ads over the last 10 years and consistently invested in mass media to support cessation. And Dorina, our colleagues from communications, will talk to you a little bit about that later on. We have our colleagues in environmental health work in the regulatory space, and they monitor our smoke-free workplace legislation. They carry out secret shopping point of sale sections with minors, and they monitor the tobacco retailers register. We also obviously try and treat our tobacco users and provide expert stop smoking services, and we're continually developing our stop smoking services. We've invested in a programme called MEC, Making Every Contact Count, and that's where we're training our health professional staff to be able to have conversations around health behaviour change and motivate health behaviour change and refer people into specialist services. And we've done that training, and we're continuing to roll out that training with our existing staff, and we're also working with our universities and our colleagues that are training our new undergraduates and health professionals, so that the new graduates are going to come out with the skills in order to be able to have those conversations and refer. We underpin everything we do through research, through monitoring, through evaluation, our programs. Our aim is to prevent smoking initiation by children and promote smoking cessation. So just I'll close with just a summary of some of our current projects, and I'll be introducing Dr. Paul Cavan in a few minutes. Dr. Paul Cavan is going to talk to you a bit about clinical guidelines and some of the specific projects. So I mentioned our quick campaign, and Dorina will talk to you a bit more about that. We're continuing developing our stop smoking services, trying to quality improve them and assure them, invest in them, and try and get new staff. We have developed a patient management system, an electronic patient management system, to record all of the activity that we do in our stop smoking services. And that has really helped us over the past number of years be able to deliver a consistent and robust service. We can transfer clients from one service to another, for example, if a staff member is on leave or whatever. And we've just built an electronic referral module. We have delayed turning that on because of COVID and the ability of the service to respond. But this new referral module will allow GPs and other health professionals to refer directly into the service. So we will be providing the service directly to patients at the quickest and most opportune point. Every year we put in business cases and bids into the department to seek some funding. And the year before last, we put in a bid for Sláinte Care funding, and we were very successful. We resourced 4 new posts to support smoking cessation in maternity. That is a small number of posts, and we hope to expand that. And that project is really working very, very well in terms of supporting women to quit. Our tobacco-free healthcare services, we're a member of the global network of tobacco-free healthcare services, and we find that network really helpful in terms of trying to promote our own organisation as a tobacco-free healthcare service. We have our own policy, and we work very hard to try and implement that and quality improve it all of the time. This year we launched a new initiative for our staff whereby we're providing free stop smoking medication to them, and obviously they can access our free stop smoking supports as well. So that has been really effective. I mentioned the global network, and thankfully we have some of those colleagues on this morning. We've also worked with the Department of Education to develop 5 new lesson plans that will be embedded within a curriculum called Social, Personal and Health Education. And this is for kind of senior cycle, secondary level students. And it's around tobacco addiction, nicotine addiction. We have a lesson on e-cigarettes. And the whole idea, I suppose, is to build resilience among children and help them to prevent unhealthy behaviours such as smoking and vaping. We've also worked with the National Childhood Network and developed a new module to be embedded within Smart Start. Smart Start is another training program specifically aimed at preschool children, and there's an award system as well to try and I suppose reward preschools for health promotion work that they might be doing. And we have a new module around the importance of secondhand smoke exposure and the importance of role modelling positive health behaviour and smoking cessation. We do some work with our local authorities, and we're really delighted that many of our local authorities have engaged with us. We've, Healthy Clare today actually are launching their Not Around Us initiative. We initially worked with Limerick Local Authority in Corlin and Nogue in Limerick and our health promotion colleagues down there. And they developed through the youth groups down there some videos and some signage to try and promote the message, I suppose, that we don't want smoking in our parks, in our playgrounds, in our child care facilities, and just the importance of the risks of secondhand smoke exposure. So that's really positive work, and we would love to see that grow. We've also worked with the Irish Prison Service, particularly Mountjoy in the progression unit. I think Colette might be on today, and her colleagues in the prison services. So we're doing a piece of research with them, and we've supported them over the past 12 to 18 months to implement smoke-free policy within the prison services and to evaluate how that's going. And obviously we try and commission our own pieces of research from time to time if we have funding allowed, and we also monitor the space in terms of research, and we also evaluate every single programme that we do. So I'm going to hand you over to Dr. Paul Kavanagh. Paul is going to talk to you about our clinical guidelines and our position on e-cigarettes now in a second. Thank you.
We just appear to be having some difficulty with Paul's connection, so we're just going to go straight to video first, and we'll get Paul back in later on.
I want to quit now because I've always wanted to, and before it was never right, and now I feel in myself, in my body and in my mind that I'm ready to quit.
Just getting older, and I kind of feel it when I'm walking, I can feel I'm not walking as fast as I used to, and I'm worried about the blood pressure, and I want to get my blood pressure down a bit.
Yes, I went for cervical screening, and the results didn't come back great at all. And obviously, one of the biggest reasons for cervical cancer is smoking. Once you get that letter that says that there's something wrong, reality hits, really.
I've kind of loads of reasons. I've 2 teenagers, 16 and 19. My mother died of lung cancer. 2 years ago I had breast cancer, and I've emphysema, the start of emphysema. So that doesn't get any better, but I can stop it getting worse.
It was mostly down to my asthma. There a few months ago, I was lying on the couch and I had a cigarette before I went to sleep. I finished the cigarette and I woke up a few hours later and I couldn't breathe. And the doctor thought it was a collapsed lung, but it wasn't, thankfully. But that gave me the shock to say, here, look, stop.
The worst thing about smoking is the cough.
At the moment I can't even walk up the stairs.
There was one day I went to the races in Leopardstown with my brother, who's very fit, and I couldn't keep up walking with him when I was panting.
Like, I'm not prone to asthma attacks. If I wasn't smoking, I wouldn't be getting asthma attacks.
I think between the smell, the taste, the waste of money, the health, it's just there's not one single thing that is turning me off, it's a whole load of things.
I think I will have a lot of support. I do have a very supportive family, and my partner's family are very supportive as well.
But also the participants that are in this campaign as well we've decided to set up a WhatsApp group so we can talk back and forward.
Look, my wife Karen wants me to give them up. My children want me to give them up. But most important of all, I want to give them up myself.
Yeah, you have to be psychologically ready, I think, to give up smoking. You have to plan it in your head and build yourself up to that day.
No, I always had support, but I think my own personal support is what I needed.
I have loads of reasons for quitting, and hopefully I will.
Stop smoking for 28 days and you're 5 times more likely to stop for good. People across Ireland are coming together to make March their last stop. Join in at quit.ie.
Okay, good afternoon, everyone. My name is Dr. Paul Kavanagh, and I work with Martina on the HSE Tobacco Free Ireland programme. I'm conscious some of you today are probably wondering to yourself, what on earth have Paul and Martina and Ed done bringing us to planet tobacco control when the rest of us are back on planet Earth dealing with the COVID pandemic? And I suppose the reality is tobacco control really is a key priority from the perspective of managing the population's health in the context of a pandemic. It can significantly contribute to reduction of risk for individuals in the population in the face of this unprecedented issue that we've been faced with in terms of COVID. There is international evidence which shows that smoking is associated with increased risk of severe disease progression for people with COVID. Smoking also leads to chronic diseases, for example, chronic obstructive airways disease, which also increases people's risk in terms of having severe progression when they're infected with COVID. And of course, smoking and chronic diseases, these interact with inequalities that there are within our society and contribute to the unequal burden that we're seeing with COVID across the population, and the heaviest burden being experienced by those people that are in our most vulnerable and challenged groups in society. And this isn't just international evidence. We've done some work within the HSE looking at the hospitalizations from COVID during the first wave that we experienced last year. And we were able to show that people who have chronic obstructive airways disease, most of whom would have developed that disease as a consequence of smoking, they were 53% more likely than people who didn't have chronic obstructive airways disease to experience in-hospital mortality, a very severe outcome from COVID infection. And that's after taking into account other factors like age, gender, and other comorbidities. So we have international evidence and we have local evidence as well, saying that from the perspective of managing the population's health through this COVID pandemic, we really need to focus in on tobacco control. And this is supported by our international community and a whole body of international evidence. And we know there are a number of different factors at play here. We know that smoking means that people aren't able to practice good infection prevention and control. There are biological reasons at play here as well. We know that smoking has an effect in terms of ACE receptors in people's lungs, and they're very important in terms of attachment and infection from the coronavirus. And then we know as well that smoking changes people's physiology. It leads to the development of chronic disease, as I said, and those factors then contribute to a situation where people are more likely to experience a poor outcome if they become unfortunately infected with coronavirus. So really, from the perspective of trying to best manage the population's health through the coronavirus pandemic, tobacco control absolutely is a key priority. But I think looking back on the year, we all recognize that we've been living through very exceptional times. There have been huge challenges and changes and a need to adapt within our health services, and huge challenges and changes and need to adapt across society as well. And certainly we would have recognized that through 2020, while we kicked off with a fantastic start in Q1 prior to the onset of the COVID pandemic, thankfully and largely due to the great work that we've done with our communications department in terms of refreshing our Quit mass media campaign, we saw a very good effect in terms of visits to the Quit website, activated Quit plans, call through to our Quit line. We did experience impact on our services over the course of 2020, which I've highlighted in the slide here. But thankfully, towards the end of the year, we are seeing some recovery in our services. And that's something that we want to build on with yourselves and our partners throughout 2021. From the perspective of the population then, there have been a number of population-based surveys, including this very good work done by the CSO looking at the wider impact of the coronavirus epidemic on our population. And what we see when it comes to consumption of tobacco products is a mixed picture. So some people who smoke reporting that they're smoking more, other people who smoke report that they're smoking less as a result of the coronavirus pandemic. And we've done some work on this as well within the HSE Tobacco Free Ireland programme. And yeah, so and what we've shown is that same sort of mixed picture. So we're seeing that some people reported to us that in the last 6 months, they were able to quit either solely or partly due to the coronavirus pandemic. But other people reporting to us that in fact, they had relapsed. People who had previously quit and had been successful reporting to us that they had relapsed, and thinking in part that that was contributed to by the coronavirus pandemic and the various different strains and stressors that are associated with that. And we would have evidence as well then to say that impact from coronavirus is different in different parts of our population, different in different age groups, different in different social classes as well. And I think it'll probably take some time, and the reinstitution of our population health surveys through the Healthy Ireland survey to get a firm fix on exactly what's happened in terms of the impact of coronavirus on smoking behaviour across our population. But we would suspect that it's probably had some sort of an impact, probably a case of swings and roundabouts, some positive impact for some people motivated to quit and stay quit as a result of the coronavirus pandemic, other people perhaps relapsing, and very probably then a differential effect across different parts of the population. So we will need to watch this space very closely. Which brings us back to what it is we're focused on within the HSE Tobacco Free Ireland programme, along with people on the call here and our partner organisations, which is about trying to progress government's agenda and government's commitment, its bold vision for a tobacco-free society by 2025. So we're very conscious that there are 5 years to go, and from our perspective, the coronavirus pandemic, we should actually look on it as an opportunity to regroup and refocus and try and accelerate our progress in terms of achieving a tobacco-free Ireland programme. And certainly within the HSE, we will be working with our colleagues in the Department of Health and advising them that our view is that it will be very timely now at this juncture, with 5 years to go towards our goal of a tobacco-free society by 2025, for us to review our progress and look and see, well, really, what are the key priorities and what are the key levers that we can pull together collectively over the coming years to try and achieve that goal. Within the HSE, as Martina flagged, from our perspective, a key focus is on trying to recognise smoking as a clinical problem and trying to ensure that across our HSE services, we're optimizing the opportunity to identify smoking as a problem with people that are using our services, and then trying to work with them through brief intervention and through our stop smoking services to ensure that they have access to safe and effective support to quit. So we were really overwhelmed late in 2020 with the very positive response and engagement that we had when we consulted on our draft National Stop Smoking Guidelines. And we're engaged now with the Department of Health, and these guidelines are going through the final stages with the National Clinical Effectiveness Committee. And we're looking forward over the course of the year to the National Stop Smoking Guidelines taking their place in the suite of national prioritised clinical guidelines that we have in the health system in Ireland. And I think that will be a very important symbol in terms of the importance that we attach to identifying and helping people stop smoking as part of clinical care here in Ireland. So one of the issues that we needed to grapple with through those guidelines, and that I'll just touch on briefly before wrapping up, is the issue of e-cigarettes. And I think the first thing to say when it comes to the challenge that we're faced with in e-cigarettes is that we really need to approach that problem with the right frame of mind, individually and collectively as people who work in tobacco control. And I think it's too easy to see this simply as a technical problem and something that experts, for example, people in a stop smoking guideline development group can tackle and can solve. The reality is that this problem is not simple, it's complex. You know, we've different views on what the problem is, different views on what the solutions are as well. There's a lot of uncertainty, the whole issue is evolving. So really we need to treat this as both a technical problem, but also as an adaptive problem that we need to tackle as a tobacco control community. And from that perspective, I think working together as stakeholders, trying to build an understanding of the problem, trying to build an understanding in terms of the solutions is very, very key. And I think our approach to this is going to be incremental. You know, evidence is evolving all the time, and I think we need to take a step, look at where we are, and then consider whether or not we need to take additional steps and look at the direction that we're taking over time. From our perspective, the work done by the HRB for the Department of Health has been very instrumental in terms of informing our view on how we approach e-cigarettes within the HSE from the perspective of how we advise people to stop smoking. And that review concluded that e-cigarettes were not more effective than approved, safe and effective nicotine replacement therapies in terms of helping people stop. So that's something from our perspective that very much informed our thinking around this. Of course, when it comes to e-cigarettes, our thoughts are around what that means for people who currently smoke, but we also need to think about what it means for people who don't smoke. And I think through the SBAD report, it very much underscored the need for us to look at this problem from those two perspectives, from the perspective of people who smoke, but also from the perspective of ensuring that we're preventing youth initiation, both of vaping and of using combustible tobacco products. And the SBAD report, which Luke and colleagues here in Ireland would have led on, was very much a wake-up call. And it did also triangulate with some regional work that we were involved in the west of Ireland through Planet Youth there, which found similar results in terms of the problem of smoking, the problem of vaping among younger people. That's an issue in and of itself. And as we know through work that the HRB has done, there's also concern that that is a step that leads younger people on to smoking initiation as well. So from the perspective of our stop smoking guidelines, we recommend a number of safe and effective supports that healthcare professionals can advise people who want to quit that they can use. We aren't currently recommending e-cigarettes. We have, however, recognised that our healthcare professionals face a challenge in terms of how they would discuss the risks and benefits of vaping with people who are interested in using vaping devices. So we have provided some advice in terms of how to structure that discussion. And from our perspective, we think a next key priority in terms of trying to move through the e-cigarette issue as a country is the progress that needs to be made aid in terms of nicotinizing protection of youth. I think our national stop smoking guidelines in terms of making sure that our health is possible towards safe and effective services, and then we can reassess and see where we are. So I'm going to hand over now. We have another clip, I think, in terms of people who are working in terms of taking that step towards making a quit attempt and the support they can get from the HSE.
Thanks, Paul. We showed that video already, so we're going to go to Darina Carr next. Darina, over to you.
Thanks very much, Paul. So, can you see my screen?
Yes, we see it. Thanks, Darina.
Thanks very much. Hi, everyone. I'm going to take you through the QUIT campaign that we ran last year. So first of all, I'm going to give you a bit of background to the QUIT campaign. So QUIT is the HSE's most established social marketing campaign and has inspired over 2.5 million attempts to quit smoking since it began in 2011. The campaign encourages people who smoke to try to quit. It also encourages them to use the evidence-based stop smoking supports, which doubles their chances of success. We want people who smoke to know that quitting smoking is the single best thing that they can do for their health and that we are on their side. So while we've seen a great reduction in the number of people smoking, there are still several challenges. Smoking is an addictive behavior, which is hard to change. And many of the remaining people who smoke are not considering quitting and are therefore hard to reach. And often people who smoke plan on quitting without that evidence-based support. So with those challenges in mind, we developed our 2020 campaign in close collaboration with people who smoke. And we started by conducting several rounds of research. We held 9 focus.
Darina, sorry, can you just start your presentation, please? We could only see your PowerPoint screen. So if you press start, yeah.
Sorry about that. Okay, so I'll go back to the challenge. While we've seen a great reduction in the numbers of people smoking, there are still several challenges. Smoking is an addictive behavior which is hard to change, and many of the remaining people who smoke are not considering quitting and are therefore hard to reach. And often people who smoke plan on quitting without the evidence-based supports. So with those challenges in mind, we developed our 2020 campaign in close collaboration with people who smoke. So first of all, we carried out research. We had 9 focus groups with different target audiences of people who smoke, including our own HSE staff. We also carried out an online questionnaire with stop smoking advisors from around the country, and we asked over 1,000 smokers about their preferred methods to quit. So out of this research, several common themes emerged. First of all, our focus groups told us that they had become desensitized to the stop smoking communications. So for example, the graphic packaging on cigarette boxes you might all be familiar with. And there was also a desire for the message to be simplified. They wanted to be given guidance in a straightforward manner. And for some smokers, the long-term health repercussions did not resonate with them. They wanted to know about the short-term gains that they felt would be more relevant to them. So many smokers feel overwhelmed at the prospect of quitting, and they wanted to know how to quit and that they didn't have to do it alone. So we used these insights to create our Last Stop campaign. The Last Stop campaign is focused on helping people believe that they can quit for good if they get the support that they need. So with this campaign, we wanted to encourage people who smoke to quit. We wanted to encourage them to use the support available, and we also wanted to break down the challenge of quitting smoking into an achievable goal, 28 days. We were also able to create a number of quit months out of these 28 days. So we're now going to share with you the TV ad that we developed to convey these messages.
When I see an anti-smoking ad, it makes me actually want to have a smoke.
It's fine. I ain't smoking, I'm having a drink.
It's not the best. You need to give up.
The only person I'm harming is myself.
You are gonna quit now, Dad, aren't you?
Yes, love. I'll quit now.
Stop smoking for 28 days and you're 5 times more likely to stop for good. People across Ireland are coming together to make March their last stop. Join in at quit.ie.
Okay, so last year we launched the Last Stop campaign in January, letting people know that if they stop smoking for 28 days, they are 5 times more likely to quit for good. In February, we started recruiting people for our March Quit Month, where people across the country would make March their last stop and quit together. And in March, we also ran a heavy media campaign across TV, radio, and social media. And from National No Smoking Day, we began following our 5 quit leaders as they quit smoking with support from the Quit Service. We ran a series of roadshows in shopping centres across Ireland where people could sign up for a quit plan and make a commitment to quit smoking for good. Something else happened in March and we had to adapt our campaign. So in mid-March, we had to re-review our plans in light of the emerging COVID-19 pandemic. We continued to run our campaign on TV, radio, and social media. We paused our Quit Leader series as it wasn't possible to film with restrictions. And we changed our social media messaging to include messages on COVID and the increase in risk associated with people who smoke. We also provided information online about COVID-19 and smoking. So we shared a series of stories of people who had used COVID-19 as an opportunity to quit smoking on social media and through the press. And in July, we re-engaged with our quit leaders and filmed the final interview series over Zoom. And finally, in October, as originally planned, we launched another Quit Month and encouraged smokers again to take the 28-day challenge. So to summarize, 2020 was a year full of challenges, but the Quit campaign performed really well, and the idea of quitting for 28 days really resonated with people. The campaign met and exceeded all KPIs despite the challenging and unpredictable year we experienced. People turned online to support. We had a 29% increase in the amount of people signing up for quit plans versus the previous year. Research also told us that 1 in 4 current smokers claimed that they were going to try and quit for 28 days as a result of seeing the campaign. And the Last Stop delivered great results with strong recall and intention to act with those who were exposed to the campaign. So our plans for 2021, we plan to build on the success from 2020. And once again, March will be a quit month. And later on in the year, we will also have another focus on the 28-day challenge. We plan to keep communicating the risk that COVID poses to smokers and the health benefits they will gain from quitting. And today we launch our new quit leaders where we will follow their quit journeys from now until the end of March. So for more information, please visit quit.ie. And I believe the next video we are going to show you is about motivations to quit.
Right, so this is a picture of my 3 kids. It's Julie, Charlie and Tara. Julie's 18, Charlie's 8, Tara's nearly 14. These are my main motivation for quitting smoking. I have to be there for them, like they've been there for me.
Look, I just like to be off them, and so that when I'm walking, I'm not gasping for air. And I'd like to have more energy, you know, going for a walk every day, every morning on the beach or across the fields or whatever, and that's what I love.
My 2 children, they're all I have in life, and they are my life. I want them to see as well that addiction can be overcome, you know, and if I can give up smoking, anybody can give up smoking.
The pandemic was only a stumbling block, but the reasons haven't changed, and it's made it harder, but it's just another challenge.
To be honest, I just felt the first 2 or 3 weeks was the hardest, and then after that I was fine. Anytime I just wanted a cigarette, I just, you know, kind of took a deep breath for a minute and went for a walk and just talked myself out of it. And then after a while I just stopped thinking about cigarettes.
I was off them for 3 months, never smoked a cigarette for 3 months, and then it was kind of like the last hurdle, and I slipped. Just one pull of a cigarette I thought I could do, which I can't.
After getting laid off for 3 months, I kind of did have a little slip. I think it was just the whole uncertainty and the stress of it. But that didn't last too long anyway. So as I said in the first meeting we had, that I wouldn't like to be letting anybody down, especially myself.
the last couple of weeks has been very traumatic because my father was fine and then he got ill and he died at 80 there 2 weeks ago. And I had promised him when I gave them up, when I started doing this, he was delighted and he was encouraging me to give them up. So I promised him I wouldn't go back into cigarettes, so I didn't.
Well, during the time that I was smoking, and the funny thing is, I didn't even enjoy them. It was like eating an ashtray. And I thought, you know what, I'm after doing 3 months so far. I can do another 3 months. And I'm back on track.
I just kept going in and reminding myself that, well, I know my blood pressure is down, and that's really, that's really, really positive for me.
Then, of course, you had to quit.ie. That would send you a message every day telling you how many smokes you would have smoked, how much you've saved. So that was very encouraging.
The only advice I give them to quit smoking would be to stay focused. Give yourself like a weekly or a monthly goal or target. Just stick with it, and it's worth it in the end.
Stop smoking for 28 days and you're 5 times more likely to stop for good. Join in at quit.ie.
Hi everybody. So we have we've heard about the Quit campaign from Darina there, but I suppose there are a whole suite of services behind that campaign that interact with people to help them to quit smoking. So we're going to meet David Phelan, who is one of those people providing one of those services behind the campaign. So hi David, how are you? Thanks for joining us.
No problem, Matt. How are you?
Good, good. So David, can you tell me a little bit about how somebody goes about contacting the Quit service?
Yeah, look, there are various ways that you can contact the service. You can call the 1-800-201-203 phone line, where you can talk to a smoke cessation advisor. That advisor will explain the Quit program to you, and you can get a detailed consultation with them. They will also call you every week for the first month after your quit date to discuss your progress and any concerns or queries that you might have had. You can also call the Quit program anytime during the opening hours for extra support if you need it. And I suppose after the first month, Ed, we always like to check back in with the clients. So 3 months after your quit date, and again 12 months after your quit date. Other methods would be the free text quit line 50100, or you can contact them through the social media channels. There's also a live chat support on quit.ie website. So you can sign up for that quit plan on the website, where you can build your own plan to quit that is personal to you. And again, all them services are completely free, Ed.
Okay, so and there is useful things in the Quit plan. I know that there's savings calculators and everything, so people could get a sense of what's back in their pocket. I know that's an important aspect of quitting to some people. So what types of support are there then, David?
So yeah, the one-to-one support, in person or on the phone. You can have group support. Text messages and emails when you sign up to the Quit plan on the website. Okay. People find them excellent and really, really, engaging.
Okay, and I know the group support. We run programs around the country where people have like a peer-to-peer group setting support, and details of where those run will go up on our website intermittently. We'll give the details where people can check for groups afterwards. So, where in the country are you based, David?
So I'm based in Waterford, Ed. I work on a funded Sláinte Care and Southeast Community Healthcare project called Supporting Pregnant Women to Quit and Stay Quit. It commenced last year, Ed, and I would run clinics there in the primary care centres based in Waterford, in Wexford, and Carrick-on-Shore in County Tipperary.
Okay, and where do your referrals to your service come from?
We mostly receive the referrals from the midwives, but GPs, practice nurses, and we also get an awful lot of self-referrals to our program as well.
Okay, and so I know the service you offer, you're seeing people face to face, but it's the same program that somebody would get if they called the Quit line and they wanted to go through the service that way, getting phone support. So what's the service like? What kind of services do you offer to someone?
Look, it's a very compassionate, it's a non-judgmental service where the client is really at the center of the program. As you said, it's about getting to know the person. So during the first visit, Ed, I suppose we talk to the person about their smoking habits, and we help to build a plan around their smoking.
Okay.
The first session could easily last 45 minutes to an hour. We assess where they are on their current smoking. We assess their past quit attempts. We would look at their nicotine dependence, like how soon they would have their first cigarette in the morning,
Okay.
how many cigarettes they would smoke in a day. We'll talk to them about the carbon monoxide. And as you know, carbon monoxide is a poisonous gas, which we can't see, we can't smell. It's the same as burning fuels, but like such as cigarette smoke or faulty car exhaust.
Okay.
So we would take a reading, Ed, on the very first appointment that we see him. This is a carbon monoxide monitor. I don't know if you can see it there.
Yeah. Yeah.
So someone who might take a read, when we do that reading on the first day, they might blow into this and they might be in the red zone.
Mm-hmm.
But one of the good things about carbon monoxide, Ed, is it leaves the body within 24 hours of your last cigarette. So you will go from the red zone to the green zone once you stop smoking.
Okay.
And that means that, you have more oxygen in your blood. So you have less pressure on the organs of your body, such as your heart and stuff like that.
Okay. And that's really good for people to see that when they come back to you and they might do that test again, that they see that comes back to more normal levels when they've stopped smoking.
Yeah.
Yeah.
We also would look at the withdrawal symptoms and help them some way to deal with those cravings. So, like the 4Ds that we mentioned, like the drinking water, delay, wait for 3 to 5 minutes and the urge will pass. Distract yourself, deep breaths. And a lot of people come up with their own 4Ds themselves, other methods that works. And usually in the first session, Ed, we kind of would, we go about setting a quit date so that when they come back to us the following week, maybe they would have set a quit date and then they go and do the carbon monoxide and they get such a buzz as themselves when they see it turning green and, they're healthy.
Yeah.
As a non-smoker.
So it's like the first appointment sounds very detailed and it's a really, really, really good examination and personal plan for somebody. How many appointments would somebody expect to have with you then usually?
Usually about 6 appointments, Ed. And look, it depends on the patient. Some people might need more, but we'll look minimum of 6 appointments. And it depends very much on the patient, Ed, I suppose. Yeah.
So it's about being flexible for people, I suppose. Everyone's different and everybody's quit journey will be different. I get you.
Yeah.
What do you see as the big challenges to quitting for people at the moment, David?
COVID-19, Ed, it's proven challenges for us all. I think with so many people working at home and homeschooling, it can be a challenge to get in the right frame of mind. But on the positive side, Ed, we are seeing more and more people actually engaging in the services because, when people are at home and they want to get back into maybe when society opens up again, they actually want to be quit, and it can be a good time for a lot of people to try and stop smoking.
Yeah. And do you continue to support people then after they've quit as well? Will somebody get a follow-up from you a year down the line?
We would, Ed. Look, we have 4 weeks, 12 weeks, 52 weeks. Look at our own Sláinte Care program. We've even put in a 2-week post-birth date when someone is pregnant, 2 weeks after newborn baby goes home. We also put in our own program here that we would follow up with them. And believe it or not, we actually had our first 2 clients yesterday who were 52 weeks smoke-free. So they were going home to a smoke-free home, which is absolutely brilliant.
Brilliant. I suppose you've said you're a little bit specialising that you work with pregnant women. Do you want to tell us a little bit about what's that like and what your special project is like down there in Waterford?
Yeah, look, it's a brilliant project. Look at the Sláinte Care funded project, supporting pregnant women to quit and stay quit. As I said, it began last year. So they include like pregnant women who've had their babies or women planning to become pregnant. But we also work with their partners, their spouses in the household. We also work with their grandparents. So we kind of have them all tied in. It's great when you get a smoke-free home. We've over 600 referrals, Ed, since the program started there last
You're
February.
busy, yeah.
And look, we have 78% success rate at 4 weeks, which is massive.
Brilliant.
We have 26 babies that are born smoke-free since the project began, and it continues to go from strength to strength.
That's brilliant. That must be one of the most rewarding things about the job, David, is when you get somebody to that finish line of a baby being born smoke-free and mum staying smoke-free after that.
Look at Ed, yeah, I love my job. It's so rewarding. Just to think that some of my actions can have a positive effect on someone else's life. And especially when you see newborn babies going back into smoke-free homes, it's massive.
Yeah.
I think it's kind of funny that even one of the first smoke-free babies that was born in the Southeast last year, they named the baby David You know, so maybe after results, so maybe that's a good omen about how well the program is actually progressing, how well it's doing. So it's brilliant, yeah.
Yeah, I think that's very complimentary of the service, to say the least. I think, David. Yeah. Come here. Thanks very much for talking to us. I think that's given people a real sense of what it's like to come in and work with our advisors like yourself. I know you're working with people face to face down there in the southeast, but if somebody calls the Quit line or they come to quit.ie and they want to engage with our advisors that way as well, they'll get the same level of service that they'd get from you as well. It's a great program, and I think you've explained it really, really well and given people good details. So thanks for talking to us today, David.
No problem, thank you.
We're going to see another video now, guys, where we're following our quit leaders, and they're a little bit further into their quit attempt.
Since I stopped smoking, I got a bike, a mountain bike, and at the start I was like dead after like 6 miles. I couldn't go anywhere, and now I'm up to nearly 100 kilometers every couple of days, you know. So
the blood pressure was the thing, you know, blood pressure coming way down. That automatically is reducing your risk of having a stroke, you know. So at my age, I'm 57, I'll be 58 in November. So, you know, when you suffer from hypertension, you're on medication for it, you know, you're just very, very conscious of that.
The one main positive effect I had, that for me personally, was my breathing. And being somebody with emphysema, my breathing is quite bad anyway. After giving up for the 3 months, I was able to go up the stairs without having to stand at the top and catch my breath. So that was one big major factor for me.
I tell you what I also did when I gave them up. I went walking every day. That was another trick.
I'd have been moderately fit, but I wouldn't have had the incentive to get up on the bike and just throw on the earphones and go. And now I have more time and more energy. I'm fitter.
I've been visualizing me being a grandmother. So, which is not going to happen for a few years yet, but I want to be around for it.
If I was to give a tip to anyone about giving up cigarettes, I think you've got to really want to give them up yourself. And you really want to outline why you want to give them up. And you need to work out how you're going to do it and think about it and get through those first 2 or 3 weeks. That is absolutely crucial.
Speak to the HSC, get their advice, because they advised me on what patch I should be using, what inhaler I should be using.
Like, I love routine, but I'm glad I don't have the routine of smoking now.
I never thought I'd give up smoking. I never thought. After 40 years of smoking, and I'm a heavy smoker, but I have done it. So I think no matter what age you are or how long you've been smoking, if you give it a bash and you do all the right things, you're on the track to being a non-smoker.
To not have cigarettes rule your life, not to have to plan your day if you're going on a trip or whatever, it's freedom.
Stop smoking for 28 days and you're 5 times more likely to stop for good. Join in at quit.ie.
Hello folks, I'm just going to share my screen here for my presentation. So thank you to the Tobacco Free Ireland programme and the HSC Health and Wellbeing for inviting us here to give a presentation on a project that we're working with Tobacco Free Ireland on called Smoking, Mental Health and Recovery, which is an initiative based on co-production with key stakeholders in this area, and it's led by Mental Health Ireland and the Tobacco Free Ireland programme. So why focus on smoking, mental health and recovery? Well, we know the population rate of smoking from the last Healthy Ireland survey is 17%, but not everyone is experiencing the same decline in smoking rates as the general population. And we know for people with lived experience of mental health challenges that the smoking rate is somewhere between 30 and 40%. People with mental health challenges smoke more heavily, have an increased dependency on nicotine. And also some research from the UK has shown that 1/3 of all tobacco consumption is consumed by people who have mental health challenges. So it is a very challenging addiction, and it's very challenging for people who smoke. This is leading to a growing health inequality for people with lived experience of mental health challenges. But we do know from the research that people who do have mental health challenges are as motivated to quit. So we need to look at how are we providing services, and is there a smoking intervention gap? How can we provide services to help reduce the rate of smoking for people who have mental health difficulties? In terms of, smoking, mental health and recovery, we know that smoking is a risk factor for developing mental health challenges. It can exacerbate symptoms. Smoking also increases the metabolism of some of the medicines that may be prescribed to people who have mental health difficulties as they move along their journey of recovery, which means that there's higher doses needed. Smoking impacts negatively on sleep, and it leads to changes in the brain, and it ages the brain. But we also know then that quitting smoking is good for our mental health and well-being. So if we quit smoking, we have an increase in positive mood and quality of life. A lot of the campaigns focus on the physical improvements in terms of health, but we know there's a lot of benefits in terms of our mental health. It can relieve stress and tension. Some doses of medications may be able to be reduced. Our sleep improves. We know the physical benefits, and there's also economic benefits which can reduce financial stress. Everyone should have the opportunity to quit and win, and we need to look at maybe how we approach the issue of smoking for people who have experience of mental health difficulties, and to give them the best chance of quitting smoking. In 2009, the Tobacco Free Ireland programme and Mental Health Ireland came together to co-produce an event around this topic, and to really rethink our approach in terms of how we can provide services for people who use our mental health services or who have lived experience of mental health challenges, and give them the best opportunity to quit smoking. We opened up a space where we could have open and collaborative dialogue between everybody that has a stake in this topic, all stakeholders, family members, service users, service providers, so that we could really take a look at this topic in greater detail. It was very much based on co-production, where we brought everyone together on an equal footing to really listen to what was being said about this topic and how we could move it forward in a recovery-focused way. It was so important that we had the voice of someone who had lived experience, but also was who smoked, so that we could really hear what it meant to them to want to be able to give up, as we know that people who have lived experience of mental health difficulties do have the same levels of motivation, but they may face additional challenges. We were very ambitious in terms of how we approached smoking and the tobacco ban back in 2004. And we really need to show that same level of ambition and leadership in terms of tackling smoking rates for people who have lived experience of mental health challenges, so that they don't get left behind. And there's a real opportunity, if we bring everyone together, to forge a path forward in terms of making a real difference to the lives of people who have mental health difficulties. These are just some of the findings from the event on that day, but there was a great energy in the room that day in terms of creating opportunities for people who want to quit smoking. Access to supports within the services was mentioned, making it part of the care plan, access to education and training, and taking a holistic view of health. It was really important that there was strong leadership in terms of driving this topic forward and taking a compassionate approach to people, as we know this is a very challenging topic. After this Conversation Cafe, the Tobacco Free Ireland programme and Mental Health Ireland produced a findings report, which is available on Mental Health Ireland's website, and you can look at that in greater detail. But to take this topic to its next step, we brought a co-production group together with key stakeholders in this area to develop a guidance document, so that we can really look at this issue and provide a resource and support for people who use the services, who have lived experience of mental health challenges, and who provide services, and all other key stakeholders, to be able to really make and take a recovery focused approach to the issue of smoking, mental health and recovery. I just want to say thank you to everybody for taking the time to listen to this presentation and to engage in this topic. And we're going to show you now a presentation or a video from the event, the Conversation Cafe, which will give you a sense of what that day was like.
Today's event is a collaboration between Mental Health Ireland and the HSE Tobacco Free Ireland programme. We've consulted with a range of different people and really co-produced every aspect of this event. The main aim of the event is to bring people together to have a conversation about smoking, mental health and recovery, and how we can break new ground and move this topic forward so that everyone has an opportunity to live a smoke-free life.
Participating in this event for me as a member of the team in Mental Health Ireland has actually been one of the proudest moments of my career. As an event, it's the first of its kind ever in Ireland, where we're bringing together all of the perspectives so we can have an open, an honest and a direct conversation about addressing smoking in the context of mental health challenges and recovery.
As a service user who has had a history of smoking and huge difficulty in quitting smoking, I have great empathy for people who are trying to give up smoking. I've been down that road myself. I started smoking because I thought it would help me to relax. Then eventually it took a huge toll on my health and I had to quit. But I know how difficult it is, and I'm delighted to be here to be able to take part in this open forum.
As a recovery educator and as a family peer support worker, what it means to me to be part of this event today is to impart some information around family recovery and the effects of smoking on family recovery and mental health. And also the wider picture of recovery education and what we can do to educate people around smoking and mental health.
So a key action that I would like to see coming from today's event is that all the priorities that are identified and that have been highlighted as being really important to the people who have attended today is incorporated into the design and the delivery of services to support people who want to live a smoke-free life. So really it's co-production in action.
We know that smoking creates a dependency. We know that if somebody is a smoker and they don't smoke for a significant period of time, they feel different, they feel anxious, they feel the cravings, and that is because smoking and tobacco has a direct brain chemical effect. This is the message. Smoking interrupts with people's sleep. We know sleep is important in recovery of mental health. Far too often in this, the neurobiology and the biological side of smoking's effect on our bodies is ignored.
Recovery cannot happen without addressing physical health. We silo people and we box people off, and we think that mental health is one area and physical health is another area. And actually we have to think about the whole person. I'm hoping that as a key action from today, that we will develop an action plan and have a kind of a roadmap of this movement. So supporting those who want to quit will really help the general recovery of somebody with mental health challenges.
There's a big challenge because we're concerned that people who have mental health challenges may be left behind as we move towards a tobacco-free Ireland. And we need to think about the problem differently. And I think the main thing that we can do is to connect, engage and have discussions with people in the mental health sector. And in terms of moving on with a mental health challenge and moving into recovery, becoming smoke-free is a great step in that direction.
Sometimes the challenges for people who have mental health difficulties can be different from those who don't when they want to quit. I think it's important to capture those experiences and try to make sense of them, and it's crucial to have people involved in the conversation who have that experience and who can share honestly and openly exactly what difficulties they face when they think about quitting.
We need to listen and to understand the views and the thoughts of the people who use our services and the people who provide those services to understand how we can make a real and a lasting impact on the health and well-being of the people who live with mental health challenges in their life. I know from looking at literature in Ireland and internationally that people who live with the challenge of having mental health difficulties die between 15 and 26 years younger than the rest of the population, and that's just wrong. We want to see a reduction in those health inequalities so that everybody has the opportunity to live a life and to age positively in good well-being, good mental health and good physical health.
The beginning part for any journey like this, where we want to tackle the really high rates of smoking with people who have mental health because of the knock-on effect it's having on their physical health. And while we say all the time that you can't have good mental health without having good physical health and vice versa, it's important that we tackle the scourge of smoking, particularly among vulnerable cohorts of people and those who are suffering with mental health challenges. So the main action I would like to see today is really awareness and listening to the voice of the service user and particularly the voice of the smoker.
The only people who gain or benefit from smoking is the tobacco industry. So it's really important that we create services and supports for people who want to give up smoking or live a smoke-free life.
Together, we can help change attitudes and behaviours, and in doing so, we can help to affect positive change in everybody's life.
We need to create the right supports in the right place at the right time, so that we can create those opportunities and that no one gets left behind.
Hi, everybody. So I think we've had a pretty informative afternoon in quite a short space of time. I'm conscious that we've covered a lot of ground in terms of our whistle stop tour of tobacco control in Ireland, and we've been in various different places. From quit services to services specializing in pregnancy, to talking about smoking for mental health and recovery. But I think this slide that you'll see on the screen in essence sums up the Tobacco Free Ireland mission that we are all currently on and working towards. So there's a caption that goes with this particular image that was coined by a colleague of ours who works in the Netherlands, and he was with us at a conference in 2019, and he says that it takes a village to raise a child smoke-free. And I think that's poignant, and it really captures the whole of community and whole of organizational effort that we need to put in place to be able to create a tobacco-free Ireland and get our prevalence rate down to less than 5% by 2025. This image was developed by the Not Around Us group in Limerick, and it really captures the type of joined up thinking that we're trying to create in terms of denormalizing tobacco use for the next generation. I suppose our assault on tobacco use needs to be two-pronged. Obviously, those people who do smoke, we need to reach out to them to bring them into our services, to give them the help that they need to quit and stay quit. But on the other hand, we also need to make sure that the generations following on behind us don't start smoking, and that they don't become addicted to nicotine needlessly and need to use services then in the future. So the creation of tobacco-free communities in order to really denormalize tobacco use is what we would call on people really, I suppose, to help us to create. There have been a couple of queries about smoke-free schools and third level universities and things that I've seen coming in the Q&A. And while there might not be specific legislation and deadlines in terms of these organizations having to go free legally at this point in time, there is work happening around the country in these organizations. So in terms of universities, off the top of my head, I know UL and Trinity are tobacco-free campuses. There is a plan to go tobacco-free in UCC. So if that's of interest to some of the organizations on the call with us, please do reach out to us at TFI for Tobacco Free Ireland at hse.ie. That's TFI at hse.ie. And we can put you in touch with the organizations that already have done some of the groundwork, have some of the documents developed in X, Y, and Z, and we can put you in touch with them. In terms of what can we do and what can you do to help to build a tobacco-free Ireland? I suppose if you are a smoker, ask us for help to quit. You're 4 times more likely to quit with our help, and we'll be promoting quit heavily in March as a quit month. All of the tools to support your friends and family to quit are all available on quit.ie. Or you can phone 1-800-201-203 to speak to the advisors on the quit line. And we also have all of our face-to-face HSE services where you can meet people like David and get that expert advice and support and guidance to help you or a loved one or a colleague to quit. We would encourage you to ask about tobacco-free policies in your workplace. It doesn't really matter where you work, whether it's a public organization or a private company. Everybody has the right to work in a tobacco-free environment. We have a suite of tools available to people to help them to start to think about how you might go and implement tobacco-free policies in an organization. And we'd share all of that stuff on links that we'll add to these slides, and we'll pop them on the website. There will be a link to where they'll be on the HSE website. Go into the chat before the webinar ends. You can also go about further educating yourself and learn about how to influence health behavior change. So people have asked in the questions and answers about the Making Every Contact Count program that we have in the HSE. So these are health behavior change modules that were designed with healthcare professionals in mind, to train people how to make meaningful interventions with their patients and clients about health behaviors like tobacco, alcohol consumption, physical activity, and healthy eating. But all of these modules are openly available through the HSE website. And as a member of the public or another organization, you can go about undertaking these modules as well and complete this training. We also have some more specific training in tobacco specific interventions and on recommending nicotine replacement therapy, and we can share all of the links to these online training modules if people are interested in going about completing them. We would encourage people to in order to create these tobacco-free environments, to lobby your local representatives and to really be ambitious and, you know, joined up thinking and to work with other organizations to try to create tobacco-free villages, towns, cities, and things like that. And we've had discussions with tobacco programs and health services in other countries about potentially looking at twinning programs where we would twin tobacco-free towns and villages with ourselves in the Netherlands and Germany and etc. So there's an awful lot of food for thought there. And we will point you to our suite of tools that we have that you can use to start to think about doing this kind of work. Again, feel free to reach out to us at tfi@hsc.ie, and any help that we can give you, we'd be happy to. I suppose this year, Dublin was supposed to be the centre of the tobacco control world for a couple of days in March. The World Conference on Tobacco or Health was supposed to be taking place in the conference centre in Dublin this year. Unfortunately, due to COVID-19, we can't have that event go ahead. There was set to be 2,500 odd international delegates coming into Ireland for that particular conference. But the conference has moved online, and there will be a virtual event on the 6th and 7th of May, Leadership Summit on Tobacco Control. Taoiseach Micheál Martin, Minister for Health, Stephen Donnelly, and Michael Bloomberg from Bloomberg Philanthropies and former presidential candidate from the United States will be on that particular webinar speaking and presenting. So I know that's been shared in the chat in terms of where you can go to register for that, but we'll also put those details up on the HSE website, and we'll point you towards that as well. This webinar has been recorded, so we'll put the video up on the website as well. There's going to be a short feedback survey that will ping up on your screen for you to complete, please, before Zoom closes. And I think to play us out, we're going to meet the Quit Leaders for 2021. So I'd just like to thank everybody for joining us today. Thank you to all my colleagues in the background, everybody who presented and everybody who helped organize this, but a special thank you to everybody in the audience. I can see there are still over 200 of you that have stayed with us for the entire webinar. So thank you very much for your engagement, and we look forward to working with some of you in the future. Take care all.
I've tried numerous times before quitting. Stress pushed me back to them.
I have no problem quitting. My problem is staying.
It is a hard time to give up, in the sense that we're all deprived of so many things, but I keep telling myself that's not a deprivation.
I've tried a couple of times to give up, but I think this year with the pandemic and with everything.
Like you'd be lying on the couch watching something on telly and you just say, I'll go for a fag now just to relieve the boredom, you know, and I'll probably be smoking more.
The last straw was my wheezing, kind of in the evening time.
The last, say, year or two, I've been feeling the lungs.
My dad died of COPD, and I saw him at the end, and why I didn't quit then, I don't know.
When I saw this program, I saw how much support was there. If I'm ever going to do it, I may as well do it now.
I kind of want to do it and hopefully succeed, so that I can inspire, you know, like the likes of my mother, who's been smoking all her life also.
Stop smoking for 28 days and you're 5 times more likely to stop for good. People across Ireland are coming together to make March their last stop. Join in at quit.ie.